Today I'm going to be your student nurse from WT. Can you please state your name and date of birth? Okay. Today I'm in order to insert a Foley catheter due to urinary retention. You shouldn't feel any pain or discomfort. It will feel a little unusual. Do you have any questions for me? Are you allergic to iodine or betadine? No? Okay, perfect. Now I'm going to do the proper perineal care. And then I'm going to set a rag down here. Alright. Next, I'm going to move this over here. And then I am going to take out my catheter kit out of the package. I'm going to take my gloves off. Open my package. Next, I'm going to get my sterile gloves. And I'm going to open it away from my sterile side. Put my gloves on. Grab this. Grab these. This. And throw this. Now I'm going to pinch my kit. And move it. Now would be a good time to make sure you have a second nurse or a second set of hands so they are able to position your patient. Now I want to toss those. This is the lube you would use if you had an actual patient. My flush. Toss that. Alright. Air bubble out. Go. I'm going to attach it. And I'm going to get my sticks. And then I'm going to carefully remove the cover of my catheter. And then I'm going to pretend this is a sterile lubrication and lubricate my catheter. I'm just going to place that back in the box. Now I'm going to clean my patient, and I'm going to hold open her labia like this. Going to do one drop, two drop, and three drop. Next, I'm going to grab my catheter. Can you cough for me? Okay, and then I'm going to begin to insert it. You're going to insert it about 3 to 5 inches, and once you see urinary starts entering the tube, you know you've made it to the bladder, and you'll enter it about 2 more inches. After that, you're going to fill up the balloon to about 10 cc's. Alright, now you don't have to be sterile anymore. And so now you're going to grab it and gently yank it and make sure the balloon is full and intact. And if this were a real catheter kit, I would be sure to have the patch that you use and tape it. And then you'll tape it right here. Lift it around your patient and be sure that your catheter is hooked on a permanent spot of the bed below the patient past the bladder. Alright. I'm going to get all my supplies. Clean up. And this is what you would use if you needed to get any urine out of the Foley, or be sure to get it out of this. Now I'm going to lay my patient down. Cover her. Alright. If you feel any pain or discomfort, please don't be scared to call us or hit your call light. If you need to get up, please hit your call light. We don't need you tripping over your Foley. Can I get you anything? Do you need anything to drink? And I'm going to make sure all her bed rails are up and her wheels are locked. Alright.
Go.
Several days. Hello. I'm Ariana. I'm your student nurse today. Can you please state your name and date of birth? Perfect. I have an order to remove your Foley catheter today. Are you in any pain? No? Any discomfort? No? Perfect. You have any questions for me? Okay. Alright. Now I'm going to have a rag placed here. And then I'm going to remove the fluid from my balloon. Alright, and you always like to double check and make sure that this fills up to as much fluid that you put in it. Alright, Now, I'm going to pour this on the count of 3. 1, 2, 3. Alright. And now I would dispose this and make sure this is empty and dispose it in biohazard. And I would do the proper perineal care and make sure her skin is intact. Alright, Miss Rebecca, you have to void in the next 8 hours, either using the toilet, bedpan, or bedside commode. And if you are not able to, then I would get a bladder scan and see if there's anything in her bladder for her to void, and if there is, I would be sure to notify the doctor. Alright? Can I get you anything? Are you in any pain? No? Alright, and I'm going to position her, make sure her bed is low and her wheels are locked. Okay.